Even before a baby is born, it's very important for an expectant mom to select a pediatrician. The way that she would do this is to visit their office and meet with them and find out what kind of a practice they have. There'll probably be 6 to 7 visits in the first year that are scheduled visits, and there might be a few more if the baby comes in for some small problems, a feeding problem, a fever, an ear infection. Those things happen.
After the initial visit, 2-3 days from going home, there's a 2-week visit, 1 month, 2, 4, 6 months, 9, 12 months, and after that at 15, 18 months, 2, 2.5, and once you reach age 3, it'll be once a year.
One of the reasons why we see them so much in the first year is that the babies change dramatically. Not only do they grow quickly in the first year, but their development changes quite a bit. They go from this little 7-pound baby that eats, sleeps, poops, and pees, and by a year of age, most babies are walking or they're close to walking. They interact with their family. They can use their hands to grab and manipulate and explore their world. And so we want to monitor their development very closely to make sure that they're progressing as we think that they should. We're very, very pro immunizations. We follow the schedule of the American Academy of Pediatrics in terms of when to immunize children. We get so many questions about the safety of immunizations, and I can assure you that vaccines are very, very safe.
Vaccines are the #1 way we can prevent childhood or infant mortality, and it is so vital to the health of that baby. Immunizations, we follow a schedule, of course. We are offered the hepatitis B at birth at the hospital. Then vaccines typically occur at 2, 4, 6 months, and then at 12, 15, 18 months, then age 4, age 11, and age 16.
Immunizations are probably one of the most successful public health accomplishments of the 20th century. We've been able to eliminate many, many diseases that were commonplace a century ago. But nowadays, we immunize kids against many, many more diseases than what their parents and grandparents were accustomed to. So people worry if we give too many shots or if we put too much things or too many things into their bodies. But the vaccines have come a long way over the years. And while we do immunize against many, many more diseases nowadays, the components of the vaccines are probably 10% of what it was, several decades ago. There's many questions about autism and immunization, and there just isn't any scientific information that suggests there's a link between the two. There have been many, many scientific papers and studies that show that there's no link between autism and immunization. You want your children to be immunized according to the schedule. We know that the vaccine schedule that we use is effective and that it's safe. And we don't know spreading them out is really beneficial. A good analogy is this. If you're taking a road trip, you would not get to the end of your trip and then put on your seatbelt. It does you no good at the end of the journey. And if you're lucky enough to make it without an accident, that's good. But you need that seatbelt. You need that protection for the trip. And that's what immunizations provide.
I don't encourage over-the-counter medicine in babies, especially if they're going to be under 2. You should always speak with your pediatrician. You may use acetaminophen, the fever and pain reducer, once a baby's over 30 days old, still with the guidance of your pediatrician. And the ibuprofens may be introduced after 6 months. But any over-the-counter medicine, you should always check with your doctor, especially when they're 2 and under.
For moms that have no insurance, they can always get their children immunized. They can go to the Southern Nevada Health District and get their immunizations. the same immunizations that would be given at a pediatrician's office. And sometimes moms think if they have Medicaid, they can't go to a pediatrician's office, but that's not true. We have the same vaccines that they do at the health department that are given to the moms at no cost. There's also ways to have your child be seen by a physician. There are clinics that are available for people that don't have any insurance, that don't have any money.
Whenever in your heart you feel your baby is not doing its baby things well, especially 30 days and under, babies eat, sleep, poop, pee, and cry, and they should do it vigorously. No wimpy babies is what I tell families. So if in your heart you think there's something not quite right with the baby, you must call the pediatrician's office, get in,